All righty, we are back. We did this technology check yesterday. The
And it worked.
fun part of technology. We're going to go ahead and get started. Good afternoon, everyone. My name is Dr. Priscilla Bowens, and welcome to MD plus DVM, where we bring animal health and human health together to have a One Health discussion. We do that by gathering MDs, human physicians, and DVMs, doctors of veterinary medicine, like myself, and we talk about the interplay of human and animal diseases. So, before we do that, we want to let you know about today's show. We're going to talk about your health, your pet's health, whether you have one or not, and the interplay of how ecology plays a role in the transmission of disease. And we're going to also do that by bringing on our special guest, Dr. Danielle Lee. Before we get started, though, we want to introduce our co-host. So I'd like to have Dr. Kimberly Johnson Hatchett go ahead and introduce yourself. Please tell us a little bit about your background, where you went to school, and what inspired you to be a human physician.
Hello, everybody. Again, my name is Kim Johnson Hatchett. I am a medical doctor and I'm actually a neurologist. I'm a board certified neurologist and clinical neurophysiologist. My backgrounds, I'm from Kansas City, Missouri. I went to the University of Missouri, go Mizzou for undergrad, and got a degree in business finance. And then went on to medical school a few years later and found an interest in neurology and the brain and nervous system. So it's something that I'm really passionate about. Um, let's see, I work with in the community at a community hospital and also work as an administrator. I'm a mom and a wife. I have two great girls that are 3 and 5. And Dr. Bowens and I are actually cousins. And so we grew up together, inspiring each other. She inspired me to go back to school and get my doctorate. And she continues to push our family forward for greater things. So I'm really excited to be co-hosting today, and we're excited about this new adventure in our life.
Thank you so much, Dr. Johnson Hatchett. We're going to go ahead and get started. And we want to talk about why we chose COVID-19 as our first topic. And I'm going to do that by bringing up some statistics. I'm going to share my screen. We're going to bring up some statistics from the CDC. So when you look at the cases here in the US, you can see that we have about 2 million cases and 119,000 deaths. Dr. Johnson Hatchett, did you want to give any type of insight on what we're seeing now that the country has, for the most part, opened back up?
So for the most part, we're seeing a real scary spike in the number of cases. Florida, Arizona, Texas, Illinois, North and South Carolina, California, those states are all seeing big jumps. And the big jump that we're seeing is also in a different age demographic. So we're seeing people in their 20s and 30s. That's the highest number, especially in states like Arizona and Florida. The number of cases is increasing rapidly. We're seeing an uptick. So the first wave that we thought we were going to be out of by now, we're continuing to ride that wave.
Right. So let's talk about some questions that we often get. I get a lot of these questions, and just really quick about my background. I have been a veterinarian for 14 years. I did my undergraduate and graduate and veterinary work at Tuskegee University in Alabama, Tuskegee Tigers, TU, you know. And I did my master's in public health at the University of Florida. Now, I also have a law degree from the University of Texas at Austin, and it's very useful when it comes to talking about policy initiatives as it relates to public health, human health, and animal health. So we get a lot of questions, and some of those questions are, can animals get COVID-19? And if so, can they give them to people? Dr. Johnson Hatchett, do you get those types of questions as well?
Yeah, I do. I get those questions where people are fearful that they're going to give it to their dog or their cat or their bird. And can that dog, cat, or bird give it back to them? So that's one of the big questions that a lot of my patients have. They're worried, they're concerned.
Yeah, I get those types of questions as well. And we want to just let everybody know that your pet, if you were sick with COVID, you could actually potentially give your pet COVID-19. There is data out there, the CDC, the USDA, or the United States Department of Agriculture has results out there. If you were to actually potentially give your pet, you could actually potentially give your pet. There is a data out there. There is a data out there. The United States Department of Agriculture, the United States Department of Agriculture has results out there.
I'm gonna try and put these in.
In addition to that, we also know that in the Netherlands, you have mink that have been known to actually give SARS-CoV-2 to their farm workers and back and forth. And that's what we call zoonotic disease. So we want to just let everybody know there is a real possible concern with humans transmitting the disease to their pets. And as we are finding out in the Netherlands, people can actually get the disease transferred back to them. And I want to ask you guys over in the comments how the sound is right now, because we want to make sure that everybody can hear us. Can you hear me now? I promise we did this check earlier. Okay. All righty. So we're going to go ahead and pick back up. And I think it's time to bring on our special guest, Dr. Danielle Lee. And Dr. Johnson Hatchett, can you please introduce her? I'm going to go ahead and bring her in.
Great. So Dr. Danielle Lee, I don't know can you all hear me? Dr. Danielle Lee, she is a friend of mine that I met in St. Louis while I was at St. Louis University in School of Medicine. She has a PhD in biology. She went to undergrad in Tennessee Tech and has been studying ecology, which is the study of animal behavior. And she's traveled all over the world, including Tanzania, and studied these particular type of pouch rat, which is really exciting and fascinating. She's a TED Talk alumni. She's been a tech and diversity and science STEM ambassador for the White House. And she's just an internationally acclaimed researcher. And we are really blessed to have her as our first guest. And I'm really blessed to have her as my friend. She's also one of my sorority sisters in Alpha Kappa Alpha. And so she's just a beautiful ray of sunlight. Thank you for being here.
Thank you. I appreciate you all for having me.
So we were, talking about this pandemic and just the transmission of it. And everybody knows that, or everybody's heard the history of how it started in China with these bats that were at a live market that people were buying for food, which, to each his own. And so can you kind of give us kind of a rundown of how this actually happened?
Right. So coronaviruses overall, they're a family. So they're like a family of viruses. And all coronaviruses, as far as we can tell from the evolutionary history, all come from bats of some sort. So like that's the genesis host for all coronaviruses. And the bats in that particular region coming in contact with the live market, that's really important. So it's this human activity of bringing together a lot of different types of animals, whether that's for food, whether that's for trade, whether that's for protection, whether that's for making other things out of, so like medicines or any type of other consumption, they all come together in one place. And right now, the likely suspect is it was at this live market that bats that came in contact with pangolins, which are these beautiful animals in a different group. So pholidites, they're beautiful because they have these scales, where they're also one of the most trafficked animals in the world, because for a lot of traditional Chinese medicine, they want these animals. So it's a big live market. Imagine a flea market with just living animals everywhere. And that's where we think that jump or that spillover happened from the coronaviruses. So all bats seem to be susceptible to coronaviruses. They have them, that's where it starts. And then they make a jump into a different species that hasn't evolved with this virus. And then that's the animals that either get sick or they pass it on to a different species that gets sick. And that's what we're seeing right now happening in people.
Okay. So the scaly animals, those were like lizards. They were like
no,
lizards.
They're mammals.
Oh, wow.
They're beautiful. They're called pangolins. They're beautiful. They look like when they wrap up in a ball, they're mammals. They are mammals. They just have these beautiful scales across their whole body. They're closely related to anteaters.
That's what I was getting ready to ask. Are they like anteaters?
Yeah, okay. They're closely related to anteaters.
Okay. So they're thinking that it jumped from those animals into humans.
Yep.
And it was from the humans handling these animals, and they might not have even been
handling or just coming in contact. So that's the thing with viruses. Virus ecology doesn't always require a touch. In other words, we don't have to physically touch them to pick up the virus. Viruses can sometimes be oftentimes transmitted on other parts of the environment that we don't register or we take for granted. So water droplets can be transported through the air. So the invisible ecology, if you think. So in the air or in water droplets, not necessarily rain, but like the vapor, the humidity, those types of things. They can become aerosolized when you're in cleaning up after animals. So their dander or their feces. And so sometimes it gets aerosolized and you breathe it in, or you could touch it in that case when you're in the middle of cleaning up. But you don't always have to necessarily touch it. It could have just come from just being in the vicinity, coming through the market. And individuals who are handling the animals are at higher risk because they're in contact with them more, but maybe it wasn't necessarily touching.
It's amazing.
Yeah.
That's amazing and scary.
It is. I joke a lot that I'm probably a carrier of a lot of stuff because I work with wild animals, and I work with animals that carry a lot of things. I work with animals and continue to work with animals that have caused lots of zoonotic outbreaks right here in the US in the last 25 years. Yeah.
So when we're thinking about this virus and thinking about just overall the number of viruses that are out there, do you foresee an end? Like, we're hopeful for a vaccine that things will kind of normalize and going back to normal life. Are you thinking that is a real possibility? Or, I mean, I know I have my viewpoint, but I want to hear from an expert who's out there is studying the nature of things, like the whole
the ecology of this tells me we need to develop a new normal. It's time for us to start imagining a new normal. Viruses don't just go away. Like, our best bet of a virus going away is if we had caught it early and we had stopped it in its tracks, physically moving across the globe, or kept it from jumping into a different species, that was our best chance of kind of getting a handle on it. But now that it's jumped to a cosmopolitan species, us, and it's doing, COVID-19 is running a Boston on us. Let's just call it what it is.
Yeah,
it is. And it's hard to bring that out. If we had stopped it early on, it's time for us to come up with a new normal. It's here to stay. Viruses don't really go away. They're here with us.
And that's the thing. Like, I think that when we talk about how to fight the virus, we need to think about it on a cellular level, because once your body's exposed to a virus, it fights it off. It doesn't win. The virus doesn't win. If you fight it off, it has developed a roadmap on how to fight it. So when it sees it again, it says, oh, I know exactly what to do to get you. I remember I send out a signal and I'd say, okay, get this one, this one, this one, and this one, different types of immunocells, and it fights it. So we have to develop our immune system to fight off this virus, because the likelihood of herd immunity happening, and someone kind of go through what herd immunity means? Because that's something that I think that we need to focus on as well.
Yeah, I agree. Dr. Bowens might be best for that. I will say this: herd immunity isn't about you. That's the one thing it's important to understand. Herd immunity is about the community, or about the population. And the risk of herd immunity it means accepting that some people are going to get sick and not come back. So it is not a solution that benefits you, and it means somebody's going to get hurt, possibly die. But the details of it, Dr. Bowens, would you mind going through it for us?
The details of what? I can't hear you.
Oh, herd immunity.
Herd immunity, yes. I can't go into that for you. So herd immunity, just in its most basic terms, talks about the immunity of one or more persons, and them being in an environment, or say you have a city where, X amount of people are vaccinated. And because of those individuals that are vaccinated, when you're exposed to the disease state, that helps with keeping everyone else from getting infected. So that's something that with influenza vaccine and with other vaccines that are out there, when you go get your kids vaccinated, we're hoping that, a certain X amount of children have been vaccinated in order to help prevent the spread of disease. It's always best if one is able for everyone to get vaccinated, but I know that is not the case. That's not always the case, but that helps. The more people that get vaccinated, the more helpful it is in order to prevent disease. Yes. So thanks for asking that.
Yeah.
When you said kids, I thought, the door's open. I might be able to hear kids here pretty soon.
No.
So I had to shut the door. Well, yeah, so that's something that I think, like, I don't want to say the Netherlands or Switzerland, one of those countries, that was their theory. They thought, okay, if we get herd immunity.
That was Sweden.
Yeah. If we could get herd immunity, maybe we could do something with this. But overall, the Swedes are a healthier people. So, them being exposed to this virus, you don't know who's going to be the one that gets the virus and gets really ill and gets really sick. But we have found that people who have underlying chronic disease have a much higher severity of the disease, of the virus. So they're more likely to be hospitalized and also more likely to die.
Yeah.
And of course, the cat's out of the bag, because now we know that African Americans, Latino Americans have at baseline more chronic disease. So we are getting the virus at not a higher rate, but a higher severity.
Yeah.
Right.
So that's the thing that is disconcerting, and that we have to really get our mind wrapped around and figure out, because it's, like you said, it's a new normal and we've got to get it together.
Yeah.
Yeah. And I'll just jump in there and say, on a personal level, I battle with hypertension, and a lot of that is due to genetics. And other factors, sometimes stress from the job, but that's something that you would look at me and you would see me as a 39-year-old, and you wouldn't think that that's something that I would be dealing with. But it's so important. I believe Dr. Johnson Hatchett has said this before: to make your body your weapon. Yeah. It's so important to be mindful of what we are ingesting, the food that we eat, the type of exercise that we are receiving. Of course, you want to do the type of level strenuous exercise that your doctor recommends, but it's so important that we know ourselves, that we know our bodies. And in addition to that, that we know, and when we talk about human and animal health, there's a human and animal health bond. And even though there are documented cases of humans who are sick with COVID-19 transmitting that disease to pets, we also know that there are a lot of positives to being around your pet. It's been proven that blood pressure can improve, mindfulness can improve when you have your pet around. So we want to make it clear that one, you need to your body is your armor. You have to take care of your body. And two, if you do have pets, don't give them up thinking that, oh, I could give them COVID or they could give me COVID. You need to continue to take care of them and just know how important that human animal bond is. So we just want to encourage that as we discuss today.
Because I mean, we talked about this, as we were kind of developing this show, is that we're Earthlings. We all live here on Earth. We are all part of this planet. And being an Earthling, we need to have a connection with each other. And not to say that we're humans, not to say that, the animals are animals. We are all beings of this planet. And we've got to take care of it because the viruses were here way before we were. And the scary thought is that they might be here after we're here. So we need to do what we need to do to take care of ourselves and be here as long as we can.
Yeah.
Yeah, I completely agree with that. And while I was trying to figure out my sound, I wanted to make sure that it was very clear to our audience listening how important ecology plays in the transmission of disease. This is nothing new, everybody. These viruses that are transmitted, there are coronaviruses in animals that are treated by veterinarians, and there are coronaviruses in people that are treated by human doctors or physicians. So we want to make it very clear that this is nothing new. Like you all said earlier, this is not going away. And what we need to do is work together as scientists in general, human physicians, DVMs, PhDs, public health officials. We all need to work together because we need to get ready for the next one. And I hate to sound like,
doomsday.
But it's very true that the next one is coming again. We know that the first patient 0 was exposed through an animal. We know that happened. They just don't know. It's not clear what type of animal. And then as we have seen recently with mink in the Netherlands, there's a transmission there as well. So this is nothing new and it's not going away. And we have to realize that as scientists, people in the medical community who are also family and friends, and we know those around us, we have to be diligent by paying attention to what the animals are doing as well. We cannot ignore society. We cannot ignore the environment and what we do to the environment. It all affects us and we need to take care of it and take care of ourselves. So I just want to drive that point home.
And so let's be clear, because I've had this question asked. The way that the virus became the human virus was not because someone ate a bat, correct?
No, it doesn't look like that's how it happened. It's not about eating it. And one of the things to understand how respiratory viruses, which coronaviruses by and large tend to be, how respiratory viruses work is you have to take it into your body and it has to hit specific tissues. So if it lands on your arm, even if you have a cut, it's not likely to work there. It has to be this special confluence of the right kind of tissues. And so the moist tissues that lead to our lungs or lead to our respiratory tract, that's the golden ticket that coronaviruses want. They want that. And it also has to get into your body at a certain threshold. So unless you're very, very ill, just coming in contact with literally 1 or 2 viral molecules isn't enough to make you sick, assuming you're healthy. You have to literally, so that's why exposure matters. So certain metrics matter into your likelihood of one, coming in contact with it and then becoming sick. So one of those things is just pure amount of time that you spent, in contact with the virus. how much virus or how many people around you that have the virus and is shedding it. And then your own health makes a difference. So if you're already in the middle of fighting something off, or you haven't been feeling well, or you may have a chronic illness, your body's already stretched thin. Its immune response is already sending out,
Yes.
it's dispatching folks all over. And so when one new thing comes in, it's like, listen, we do our best. Send a couple of little palms out there, but we don't have time for heavy artillery because I got everybody stretched thin.
Right.
But that's what your body is, an arm of matter. That's part of the ecology. Like your body is an ecological unit, not just the outside environment. So there's this thing happening at both times. And what's happened, where the epicenter of all of this is, you had wild animals coming in contact. So even though they're in a live market, so many parts of the world, people catch wild animals and they consume them. Here in the States, we call that hunting season. So that's the thing I want you to understand. We call that game. In other parts of the world, they call it bush meat.
Right.
It's the same. So it's people all over the world still consume or catch wild animals, either because they're a nuisance or for food. And they came in contact with another set of wild animals and likely some agriculture animals, and people are all in the mix there too. So our behavior, our habits as populations of people, where we build our homes, how we treat the environment, so going into the wild, felling trees, putting down forests, all those things create new entry points for us coming in contact with animals that we don't normally come in contact with. And every time you come in contact with the new species, all their little individual ecological stuff comes with them. So that's what I mean. Back to bats, part of bats' normal ecology is coronaviruses. So we literally, you got introduced to it. We got introduced to it and had no idea.
Right.
Yeah.
Kind of like how our normal bacteria, a lot of things like E. coli kind of live in our gut. And they just live there. That's where they're supposed to be. Yeah. It's when they get out of our gut that we start having problems. But that's something that is kind of the same. Is that kind of the same theory?
That's a really good analogy for it. So so things that live in relative harmony, so some sort of dynamic truce. Mm-hmm. There's a dynamic truce between microbes, whether they're bacteria or viral or any other germ, sometimes fungus. There's a dynamic truce between the one that they've been in concert with for millions of years.
Their host.
And their host. But then when they get introduced to a new species, that evolutionary relationship isn't there. They don't know one another. There's no built-in protections and blockades to keep the host from getting sick or dying. And then that's what happens. And then sometimes they get introduced to a new animal and the animal's like, I don't know what that is. It means nothing to me.
Right.
But many times the animal's like, I don't know what that is. Our body's not equipped to deal with this at all. And everything's going not great. And that's what we've seen happening right now with SARS-CoV.
And I feel like both those things have happened. In some human beings, it's kind of like that means nothing to me. I'm just carrying it around. And in some human beings, the immune system goes berserk and has this crazy reaction and throws everything at it. And then they have an overabundance of a reaction, and then they end up having, a bad outcome. Yeah. But I think that's the other scary part about this virus, is that some human hosts are seeing this virus and thinking nothing of it.
Yeah. Yeah. So
they're shedding it and have no symptoms. So their bodies are like living in concert with it.
Mm-hmm.
So
that's the same with pets. And I want to make it clear too, to the viewers out there who have pets, if you're ever concerned, if your pet has respiratory symptoms, and again, I didn't make this disclaimer earlier, but we are not, we're not giving medical advice. We are not your doctors. I'm not your lawyer. We are, our opinions are definitely our own. I was so wrapped up in making sure the technology was working. I didn't get to say our official disclaimers. But I will say this, if you do suspect, and we're going to drive this home with our call to action, whether humans or animals, especially, I'll speak to animals. If you do suspect that your pet has any signs of COVID, if you see respiratory illnesses and a respiratory illness manifest in your dog or cat, you definitely want to call ahead to your veterinarian. You want to tell them what's going on. And especially if anyone in your household that you know of has been exposed to the coronavirus, to COVID-19, SARS-CoV-2, or if you know someone that you've been in contact that's been exposed, you definitely want to call your veterinarian. There's not a lot of widespread testing going on in animals. And it usually will take a coordination of your regular veterinarian, your RDVM, in conjunction with the local and state health authorities who will decide to test your animal. And so that you'll have to go through a series of tests. So it's not a, I'm calling and taking, Fido to the vet because I think he has COVID, especially if you or someone in your household has it. You don't want to just rush over. You want to just, call ahead. And so it's important to realize that there are a lot of viruses that manifest, a lot of illnesses that can manifest as respiratory symptoms. And so we want to make sure that, one, that the steps to take, and two, there is testing available, and it does not take away from human testing if you do decide to get your pet tested. So, or if a decision is made after consultation that you get your pet tested. So just be aware of that. We're going to move soon into our call to action, but I wanted to talk about how important that was, that you consider those things when it comes to your pet.
There's one thing that Dr. Lee just said about the amount of virus that you're exposed to and the amount of people that you might be exposed to. And so that is going to be another call to action, is thinking about when you're in public, what should you be doing? How should you be behaving in public to not only to prevent giving the virus, but prevent getting the virus, giving that barrier of exposure. So that's something that we need to think about, because if you're not exposed to it, you can't get it. If you're doing good hand washing, all those things that we're going to talk about here in a few minutes, you have a lower likelihood of getting it. So that's something that we need to be very clear about and very focused on, because that's how we can prevent it from happening. It's not a pill, it's not a drug, it's our behavior. And I think that's the other reason why I feel like our country is having some issues, is because it's a behavior thing that we have to do. We have to have a behavior change. Not, we're very used to telling the doctor, and I have it happen to me all the time, give me a medicine, give me a pill for my blood pressure, give me a pill for my heart disease. And when I start talking about naturopathic things, when I start talking about, diet, exercise, their eyes glaze over. But those are some of the things that they can do to increase their longevity and increase their health. So we're going to talk about those things, because Dr. Lee, said about the exposure and the number of exposures. So we just need to really focus on that too.
Yeah.
Yeah, exactly. So as we move to our call to action, ladies, and I want to thank you again so much for joining us. I want to thank everyone who's joined us on YouTube. This is our first episode. I'm so excited. We're going to get everything totally together next time, because if anyone out there who knows me, they know how I am in terms of making sure things work right. But I want to also talk about questions that have been asked. We have a question about steps or strategies we can take to reinforce our natural defenses. Does anybody want to take that one?
So as far as steps and strategies to improve our natural defenses. So the things that we know we're supposed to be doing: exercise, at least 30 minutes every day of some type of cardiovascular exercise. As long as you have gotten clearance from your doctor to do that, that is something that is a must. A balanced diet that is low in fat, low in cholesterol, high in fruits and vegetables, and lean protein. However you want to get your protein, plants, whatever, but something that's balanced. Hydration, drinking half your body weight in ounces of water. So say you're 180 pounds. Yeah, if you're 180 pounds, you're drinking 90 ounces of water. Drink your water. All right. So stay hydrated. And then your mental health. So that's something else that we as humans, and especially as Americans, your mental health is very important. So practicing things like meditation, yoga, prayer, and then also, I talked about meditation, but yeah, just all of those things that can help with mental health, reading, talking things out, getting things out, dealing with stress, getting enough sleep. So those things will help you overall improve your overall health and build up your immunity.
Yeah. And from the point of view of the virus, so understanding how the virus works. So the coronaviruses are actually really large. And we know that they don't, even though we know they spread in the air, they're actually so large they'll fall to the ground. That's why that 6 feet of separation as a minimum is so important. So that if someone does speak or sing or scream, you want to let that virus fall to the ground as soon as possible because it is so heavy. So things you can do, having your skin is a barrier, so give yourself another barrier. So that's why washing yourself when you come in from outside is so critically important. You don't want to have any what we call in ecology sweepstakes, someone just tagging along for the ride on your clothes or on your parcels. So washing your hands, wiping things down. If it's nothing that's critical, let it go ahead and sit out in a ventilated area or in sunshine for a while before bringing it in. So, or if it's food, put it in the freezer. Like you understand what the virus needs for a living and then work against it. Right. So the virus wants people close together so that it can literally like leapfrog from person to person. So that's why we want to be far apart. Using the mask so that it blocks that so it doesn't jump. That's one thing, or a sneeze guard. Humidity seems to be a thing. So in other words, that water in the air seems to be a factor that may help in coronaviruses in general. We don't know about COVID. We're still learning so much about COVID. The answer is we're still learning everything new. But what we know about the family of coronaviruses is that most of them don't do well in humidity. So that's why come on in, wash yourself off, get in the shower. That washes that virus off. It makes it fall to the ground. Understanding the relationship between that. And then back to the sociality. So how we behave, our culture is a mechanism for transmission. Because contagious disease, love it when we're in each other's faces. It doesn't matter what kind of contagious disease it is. When they see that we're all in each other's faces, they're like, yes, that's what we want.
Let's do this.
And not only that, it's some evidence out there that some diseases actually manipulate our behavior in a way that helps them spread itself. That's why rabies makes animals rabid and go seeking other individuals. That's a behavioral manipulation that harms the whole level. Yeah. It literally, so viruses don't only hijack our machinery, it hijacks our bodies to say, make more copies of me, stop making cells. It actually hijacks, in some cases, it'll hijack our whole organism and our whole behavior so that we're doing things about helping the virus. It's like literally you're being possessed by the virus, and the virus do these things that pass me along. And you're like, why did I do that? Why was I in each other's faces? It's because the virus transmission. The virus likes that. So be mindful. Like think about that. Like, am I doing something that the virus wants?
That's hard. That is something that may take a little more time to think about. But I mean, it does make sense that when a virus infests a host, it does everything that it can do and manipulates the machinery in order to transmit to the next person. Even if it kills you, as long as it gets transmitted, it's about rate, how fast you're infected. I do want to bring up questions though that some people may have about, so we talked about all the things we can do on our own to help fight the virus, precautions that we can take, using our body as a weapon. But what about are there current initiatives with there are different medications, what about vaccine testing? I've read several Science magazine articles about antibodies being developed in cows. Some people take issue with that for several reasons. But do we have a cure for this? How close are we? Does anybody know? Like what have you guys seen?
We're about as close to a cure as we are to Mars.
What did you say?
We're about as close to a cure as we are to Mars.
Right. And I mean, well, can you, and to your point of not having one yet, Dr. Johnson Hatchett, you are in the hospital with humans. I know there's no cure for pets as we know of right now. We're not seeing high rates of mortality. We only have several documented cases. We're having some questions come in about socially distancing dogs. at the dog park. We don't know yet about, how the rate of how the transmission would, how fast, or if the 6 feet would make a difference with pets. But just like other respiratory viruses, there are also conditions in animals that they're highly contagious conditions like kennel cough, that's caused by a number of agents, more widely known Bordetella bronchoseptica. But you should be social distancing anyway from your neighbor and their dog at the dog park, or someone, at a city dog park. You should be practicing social distance anyway. But if you aren't able to, there's no way that we know right now if the virus is going to be easily transmitted from pet to pet if you're out at the dog park. But that is something to keep in mind as you're going to the dog park, or if you're wanting to board your pet at the veterinarian's office or at the boarding kennel or something like that, because there are no vaccines to prevent it, and we just don't know at this point. But Dr. Johnson Hatchett, and I know there are reports that dexamethasone, which is used in human and animal health as a steroid, that it has seemed to cut the rate of mortality down by, I think, about 1/3 on patients that are ventilated. Do you know anything about how that might work?
So they're thinking that that's the people that seems to be working in are people who have the immune response where their body just throws everything in the kitchen sink at it. So it's people who get exposed to it and their bodies just say, I'm going to throw every single immune response I can throw. And what the dexamethasone does is that it calms that immune response down, and it allows your body to breathe. Literally, it allows your body to function, because that's the other thing with this virus, is that we're finding that people's kidney functions are tanking and they're having to go on dialysis. So it allows their bodies to function and make it through the virus. They might have to be intubated or be in the hospital longer, but they're surviving. The initial medication that people were talking about was hydrochloroquine, which is typically used for patients who have lupus. That came with some heart issues. Some of the patients that I've seen who've been on that have had some heart issues with it, got some side effects from it. And they've actually come out recently saying that the data that was originally came out favorably was actually falsified. So that data was not even good data. So now this medication, which is a cheap medicine, dexamethasone is cheap. And so that's even better. That gives it more access to more people. If we could use that in the right population, we might be able to get people to survive and live through this, and then go beyond that to the herd immunity, where we have so many people who have been exposed to it, where we are able to fight it. Does that make sense?
Well, that gives us gives us some clarity about where we stand in terms of treatment. I've not heard of any treatments in pets really about the recovery, but again, it's so early. It's not a lot that is known. There have only been a few pets that we have documented infections. So I think the verdict is still out, and we're still waiting and seeing and listening and hearing. I did have another question before we get into our shirts and some other things. What are the long-term impacts on recovering COVID-19 patients, Doctor? And just so you all know, if you joined late, Dr. Johnson Hatchett is a neurologist, is a human neurologist. So she is giving us her take with that background. So if you could give us your opinion on that, about long-term impacts on recovering COVID-19 patients.
So it's affecting their lungs. There's one friend of mine, I actually have a couple of friends who actually got it and survived. And they likened their lung function to someone who had been like a 30 or 40 year smoker, 1 pack a day smoker. That's what their CT scan looked like. And then weeks later, it got better. And a few weeks later, it got better. So eventually they got back to maybe 80 or 90% of their previous lung function, but it took months and months and months. We're seeing patients who are getting trached because they can't get off the vent. We're seeing patients who are intubated way longer. So people are having, months of recovery versus like the flu, you have a few weeks of recovery. but these patients are having months and months of recovery, 3 to 4 to 6 months before they get back to their baseline function.
Yes, thank you. Thank you for that. And that gives us an idea and just some understanding, because I know a lot of people compare it to the flu, and that they say, oh, it's, if I get it, if I do get sick, it'll be just like the flu, and, you know, I'll just ride it out and things of that nature. Usually, in my experience of having the flu myself, you know, maybe I'm down for a week if I get it really badly, but it's not something that I remember going on for weeks and weeks and weeks, the recovery time. So this can knock a lot of people out, not just health wise, but when you think about work,
Right.
taking care of themselves, taking care of families, taking care of pets, just doing the things that they need to do in life. This can really have a lot of people out. And I know we've talked about COVID-19 ad nauseum, but again, we just want to bring it full circle to remind everybody how important it is to consider the entire ecological system. We have to talk about that. As Dr. Johnson said, we are earthlians. We are all in this together. It's not just the people. It's not just about humans. It's not just about animals. It's about the entire society. And Dr. Danielle Lee has really tied it together all nice with a bow, even though it's more complicated, but she has so graciously broken it down to us and told us, you know, how the coronavirus is basically running to Boston on everybody. And we just have to be more aware. I know it's hard, but we have to stay vigilant in that fight. So I did have one more question. I'm going to ask this to you, Dr. Johnson Hatchett. Oh, wait a minute. Okay, we have two questions. One, should we be concerned about deforestation and driving animals out of their normal habitats? And
that's a Dr. Lee question.
Interactions. I think we all can answer that, but I'm going to go with you first, Dr. Lee. Can you talk about that?
We absolutely should. So what that means is that we're coming in contact with with animals that are normally too shy to interact with us. And even if they don't interact with us, then we have what we call those barrier animals that we do interact with. They come in contact with our barrier animals that we have contact with. And so what often happens is that the animals that are closest to you, even the nuisance animals, let's say the mice and the squirrels and the foxes and the coyotes, they're the ones that come in contact with those more wild animals. And then we come in contact with them either directly or through our pets. We absolutely need to think about this. How we use the earth, how we steward the earth absolutely makes a difference. When you have a consumption first way of dealing with things, that means you don't think about those things before just bulldozing it. I'm not saying that we don't spread out and there's not a way for us to use these things, but when you don't think before you open it up, in other words, like once the horse is out the gate, the horse is out the gate. But if you take it a little time to plan and go like, wait, let's not build there, let's build here, or let's build in this particular way so that we can make as little footprint or impact as possible. So yeah, we do need to be thinking about deforestation. We do need to be thinking about where and how we put up new human developments, how we use resources, what resources we bring over. Because this isn't just about how people spread to one another because we're so global. We can travel easily, but let's remember that our stuff travels too. In other words, that's the ecology of how these things are moving, even if it's not directly person to person. When we move agriculture products around, or when we move, consumer goods around, things still come along for the ride. Pests come along for the ride. Rats and mice, what I study, insects, bugs, and then the invisible stuff. In other words, when we start spreading out, we create human-wildlife conflicts. And what's happening with coronavirus in particular is invisible human-wildlife conflict. That's really what it is. It's the human-wildlife conflict we didn't necessarily see coming. And we need to start intentionally seeing it and preparing for it.
Yes, I completely agree. And I believe you'll agree too, Kim. And I want to do one more question and then we're going to close out because we really appreciate everyone for coming on. We want to thank our sponsors, everyone who's gotten the word out, and talk about our next episode. Dr. Johnson Hatchett, do you recommend any type of shots that someone could take to help prevent pneumonia or anything like that? Is there anything that people can do that may make them less susceptible? Like say the virus, and I'm taking it further, but say you get coronavirus, COVID-19, and it manifests, you have the virus going on. There are antivirals out there, but would anything prevent the development of pneumonia? Any type of medication or vaccines or any injections? Is there anything out there that we know of that would help lessen those symptoms other than we talked about steroids, dexamethasone?
So prevention of pneumonia, and this is something that I think that goes back to behavior. There's breathing techniques that you can use to prevent development of pneumonia. And most, when someone's diagnosed with coronavirus or with COVID-19, they're given instruction on how to do these different breathing techniques, and you need to do them as you're prescribed. So it goes back to human behavior. That's how you prevent the pneumonia from setting in, is by doing these certain types of breathing techniques. No shot, no drug. It's going to be on the individual to do it. And call me Dr. Kim. That's okay. You don't have to call me
Dr. Kim. Okay.
Johnson Hatchett.
Dr. Kim.
Sounds real formal
and I know you said this briefly earlier, but yes, Dr. Kim and I do look a little bit alike because we are cousins. We are first cousins. It's wonderful to have two doctors in the family who can talk about human health and animal health. So this is what we chose as one of our ways of outreach to helping others. And we hope that next time this gets out to more people. We know you start where you are. So we hope you spread the word. We hope that despite technology that you were able to come away with some type of nugget of information. And on that note, I wanted to quickly, if everybody could just say briefly, I'll talk about my shirt real quick because it is a part of the episode. We're not just wearing our lab coats just because we earned these. Dr. Lee did too. But my shirt real quick, it's a quote from Martin Luther King Jr. It says, "I have decided to stick with love because hate is too great a burden to bear." And so I wanted to be cognizant of the time that we were in right now. We're facing several pandemics, and I won't go into all that just now, but I wanted to just talk about the shirt behind the white coat. And Dr. Kim, could you tell us a little bit about your shirt that you're wearing?
Mine actually says "Know Yourself," and it's actually a Student National Medical Association. Back when I was a medical student, I got this shirt, and it is an organization that was founded under the National Medical Association, and it was a group of physicians that wanted to be part of the AMA, and because they were African American, they weren't allowed to be in it, and they said, you know what? We'll do our own thing. And that's how National Medical Association was born. And back in 1964, the Student National Medical Association came out of that. So it's like, know yourself, know your history, know where you came from.
Thank you. Thank you so much. And I just want to say before we get off, I wanted to give a special shout out because my husband would not let me get away with this, but he deserves it anyway. And all fathers do.
Yes, they do.
Happy Father's Day to all the dads out there, to my dad who's watching, to my husband and Dr. Antonio Bowens, who practices neurology and neurosurgery as a veterinarian. Yes, they do exist, like a unicorn. But we just want to say Happy Father's Day to all of the fathers out there. We want to did you want to say something?
I was going to say Happy Father's Day, Andre Hatchett and Anthony Johnson and Emmett Thompson and all my brothers out there. Keep up the good work.
Did you want to say anything, Dr. Lee?
Yeah, Happy Father's Day to my dads.
My father, Major Madison Jr., just want to say Happy Father's Day. And we just want to let you know about our next episode. We are going to be talking about neurologic disease when it comes to ticks. It's not something a lot of people think about in different communities. We get a lot of questions about how to spot a tick or a tick bite on skin, on human skin, especially brown skin. A lot of people don't know. I've had questions come, where a tick has been attached to a child that they got from the dog. And this is tick season where it's nice and warm. People are, thankfully getting out for a walk. So we're going to talk about that next time and what that's about. We're going to make it interesting. I know ticks sound gross, but it's something you need to know about, because your pets can get diseases like Lyme disease, and so can people. So we want to just educate everybody and let them know. And then our next episode will hopefully be about nutrition for you and your pet. And we'll have some special guests on us there. And with that, we want to thank our special guest, Dr. Danielle Lee, mammologist and dad, sister. We want to thank you for your Billie Holiday Lady Sings the Blues look. And we just want to thank our sponsors, the National Association for Black Veterinarians, Kindred Momentum LLC, Hammond Animal Hospital and Pet Lodge, Pet Nugget LLC. We want to thank you all for putting the word out, for getting the word out. And if you like this, please, please, please go ahead and subscribe to our channel. Let others know. We're going to make it even better next time. But this was a fantastic start. Please call to actions, pay attention to the animals in your environment. This is not going away, people. And the next one is probably on deck sooner than we think. Know your status, get tested. If you are sick, if you have one or more of the symptoms and testing is available in your area, please do not just stay at home thinking, well, I'll probably just get over it. It may not be that. Please know your status. Dr. Kim was very adamant that we let you guys know that. And finally, your body is your weapon. Please do everything that you can to be healthy, to eat healthy, to drink your water. We're saying these very small things, but a little can go a long way in helping to prevent the spread of COVID-19. So with that, we are going to end our stream, and we thank you all once again for joining us on MD plus DVM. Have a great afternoon.
Bye-bye.